This conference will now be recorded.
So good afternoon, everyone, and welcome to another peer-to-peer meeting for Region 4 childcare providers. Really, the purpose of these peer-to-peer meetings are just to bring providers in a certain area together around a certain topic. Today, we have Heidi Hotvedt from the Iowa Department of Public Health with us, and she'll share a little bit about some health and safety guidance. This last year has been pretty crazy, and things have been changing faster than we know it. So she'll share some of those health and safety guidance things for childcare providers, and then also just to give you a chance to ask any health and safety questions you might have about your program. This is a good time to do that as well. If you don't know me, my name is Julie Davis, and I'm the Community Development Specialist here in Region 4. So really my job is to have these meetings and help bring providers together, and also just work in the community to advocate for the availability of quality childcare. So we'll start with just a few housekeeping things. If you're new to GoToMeeting, there are some buttons on the left-hand side of your screen that will allow you to mute and unmute. We do ask that you remain muted throughout Heidi's presentation, although you are allowed to ask questions if you have them. So if you do have something to share, type that in the chat box and we can respond to you via chat, or we can share your question out loud. You'll find the chat box in the settings in the upper right-hand corner of your screen, and the chat will be monitored. So any questions that you have, we can share and get those answered for you today. So again, thank you, Heidi, for being on with us. Heidi is the Healthy Childcare Iowa Coordinator at the Iowa Department of Public Health. So I'll go ahead and make her the presenter in case she has anything to share, and then you can go ahead and get started.
Great, thank you so much. I'm going to go ahead and share my screen. So I'm going to kind of jump right in. Again, you know, this is just a time for me to share some information with all of you, and I appreciate all of you being on the call today, and also to answer questions. So we'll just kind of go through the slides. I have a few slides that I'd like to share, and we can take questions at the end, or if there's something that's specific to a slide, you can just put that in the chat, and we can just stop and kind of answer some of those and then move forward if that works for everyone. The first few slides I want to talk with you about is the COVID vaccine. So the vaccine is available to Iowa childcare providers. So I think everyone knows this, but I want to make sure that you're aware that the COVID vaccine that has been the 3 vaccines that have been approved in our state are included in the Phase B Tier 1 priority for childcare providers. So if you didn't know that, you are in the priority group, and I know that those vaccinations are happening right now. And we actually, I think last week was the first phone call that I had received regarding a childcare provider who had actually been fully vaccinated, so had the 2-dose vaccine, and it was 2 weeks past the full vaccination. So that was kind of a first-time call for the state for me, and I was excited to hear that that we were having providers being fully vaccinated. So just getting vaccinated as soon as the opportunity is available is really an important way for you to kind of help yourself and your staff to stay safe. And then also to really, you know, we're really hoping as a state to continue to see a decrease in the number of COVID-19 cases. And vaccination is really a key to push forward with getting those rates reduced. We get a lot of questions of, you know, where do I go for vaccination location information? And Iowa has the website vaccinateiowa.gov, and I have that link right there in the slide. And that is a place where you can put in your information for your zip code, and then you can look at what is the closest location for you. And then there are some information on that site in terms of how to sign up for the vaccine. I think that's probably been one of the challenges for some of our programs is to kind of find out that information. I know that some, local public health, I would just going to reiterate, check with your local public health website, you say your local public health department and their website to see if they have anything posted. Monitoring Facebook, monitoring the CCR&R Facebook pages. I think all of those areas, we're trying to get that information out to the public of, where do you need to go for finding out for vaccinations, and those are important for each area is different, so that's why it's hard, because it's the full region of the forest, the region, CCR&R region, but reaching out, and if you have questions, reach out to your child care nurse consultant, reach out to your CCR&R consultant. We will help you connect with the people that you need to connect with so that you get your vaccination. I did want to say that the CDC has a new vaccine toolkit that's specific for school settings and childcare. And you can see in the slide, one of the posters that is available for free for download is in the corner of the slide there. And these are just some fact sheets, infographics, different things that you could download and you could share with your staff, or post in your front area of your business, or share with parents. So there's just some good information available, and it's free on the CDC website, and I have the link there. And then we do have, people have questions about vaccination, and we really want you to know the facts and not, some of the myths or some of the concerns that maybe sometimes you see. We want you to have reputable places to go to get that information. And the CDC has a frequently asked questions section, and then also kind of a myth versus fact information available on vaccination. And I put the link in there. And I see some chats that have popped up as I was speaking that people were sharing that they had been vaccinated. So I even saw somebody that I think fully vaccinated on the 27th of February. So that was great. That was probably sooner than maybe my phone call the other day. So it's exciting, but we definitely want to encourage, if possible. And we know that that vaccination is one of those situations where we know children right now are not able to be vaccinated. So, and there's only one of the vaccines is I think it's just the one vaccine that's been approved for 16 and up. So we do know some of those younger, staff members that maybe haven't, weren't able to be in the group for the 18 and older, but they could receive the vaccine if they're 16 and up. So we do have those vaccinations available, but we do not have children available at this time. So I know there's testing going on. You might have seen that in the news, that there is vaccine testing for children. But at this time, we as adults are here to protect the children in care. So let's see, the next thing I just wanted to share a little bit about some benefits. The vaccines that are available right now currently in the United States are highly effective against preventing COVID. And really helps to protect those from getting increased risk for severe illness. It's a safer way to build protection than getting the virus itself. We have that question sometimes, but and then we just see that we want to continue to practice those mitigation efforts that we have already in place to help continue to reduce the spread of COVID-19. And before I jump to the next section, Julie, was there any other chats that came through that I need to answer? Any questions? Okay.
Nope, I don't see any. I just posted the links that you had on there. And Heidi, you can always share your PowerPoint slides with me at the end, and I can share those out too for anyone who's looking to, save those for later.
Yeah, great. Thank you.
Yep.
So, and I just wanted to share, we get this question a lot about kind of toys and art supplies. I just thought I would just share a little bit of information. So the CDC has posted some updated information specific for childcare on their website. And one area that we continue to get questions about is toys and art supplies. And I will tell you, this is challenging, and I know it's challenging. I've been out doing some visits just recently with some providers, and they have shared how difficult the toys and the art supply situation is. And so what best practice, of course, is just to discourage sharing of items that we can, to avoid that. And I had a provider that asked about, well, what about, manipulatives? What about, we usually have baskets out with certain things. And so I would just share, if possible, it's best if you can kind of have, a set of manipulatives, separate them out for the kids, or have different baskets so you can put a basket on the table for a center, and the child would come to that center and play with those items, and then that basket could get pulled out, and then a different basket. And I know that there's a limit of supplies, but really thinking strategically of how can I make this work. Of course, having children wash hands before they go and play with manipulatives or with toys, that's a really good, a good prevention mitigation strategy. But we do know, or using hand sanitizer, of course, if they're older child. But we do know, and I mean, just from watching children, it's very challenging, even as adults, to not constantly touch your mask or adjust your mask. And you'll see it, you'll notice it yourself, and you'll see it out in the general public. So that is a challenge, and it is a challenge for children. So, every time that mask is touched, and then we touch other things, that is a risk for those droplets. So just to really think strategically of how can I help have adequate supplies to minimize that sharing. And I know, our supplies are hard, you have only a limited amount, but I have been on site quite a bit to see that there's a lot of times you have several different bins of markers or several different bins. So, separate them out and try to have one of each color for each bin, and then, rotate those through with the kids that come to that station. If possible, if you don't have enough of those supplies or toys, clean between groups of children. And when we say groups of children, I mean individual children, but if you're doing cohorts, we do say, like say in a classroom, maybe you have two cohorts of groups of children. So you kind of are trying to keep those groups separate. Those teachers are kind of separate 6 feet. They're wearing their masks. We're trying to not have them in the same space. So if one group is, doing one area of activity, or maybe they're doing a story hour, but the other group is doing some activity in the other area of the classroom. When that group of children switch, clean those things between hand. I mean, that's another option if you don't have enough supplies. And then the other thing is, if it's difficult to clean, the stuffed animals, I know the one thing with, dress up clothing, that's a challenge, and it's challenge because when you put dress up clothing on, a lot of times the child, is pulling stuff over their head, or, doing things where their mask is being moved, or they're running it past their mask. So there's just a lot of things. Stuffed animals, kids like to hug and squeeze them and lay on them and those kinds of things, and they're difficult to wash. So, if you cannot adequately disinfect and clean your items, really try to minimize the sharing.
And there is one question in the chat box, Heidi.
Sure.
So a provider is wondering if it would be sufficient to pull maybe a basket of used manipulatives and quarantine those toys or manipulatives for like 72 hours, or is that more of a situation where you would want to try to in-depthly disinfect that right away?
Yeah, I know the CDC website has information specifically around that if you have those kind of, and we've always done this with infants, the mouth toys, we kind of have the yuck bucket, you put them in the yuck bucket, you clean them at the end of the day, you use them the next day. And so the CDC has really kind of used that same model because they know it works, and has put it into practice for CDC guidance around COVID, that you kind of have that same system. You pull that basket out of toys, you clean them at the end of the day, either run them through your dishwasher or clean and disinfect them, and then put them back into use the next day. So not necessarily needing to quarantine them. There is some really specific information about, books and those kinds of things. So the CDC website is great for some of that information. Good question. Thank you. The next thing I wanted to just share about was outdoor space. So, The weather is getting warmer. I don't know. We had 3 inches of snow over on this side of the state. I'm over on the eastern side of the state, and we had 3 inches on Monday. So it's just melting, but we are getting warmer weather, which is great because the CDC does have research that says that outdoor spaces do reduce the risk of spreading COVID-19. So that's exciting. And one thing that they recently just put on their website was, if feasible, have children and staff eat meals outdoors. So I started thinking about that, and I thought, well, that's kind of a fun idea. Maybe we need to think about how can we bring our normal activities that we would do in the indoor to the outdoor. Circle time, some physical activity with dance or listening to music, and some of these things that we normally would be always doing in the indoor space, eating, can we start thinking about moving those to the outdoor space to help reduce the risk of the spread of COVID? So staff are all wearing masks, and we know that helps. That's a great mitigation strategy, but we know that not all children can wear masks or wear them consistently. We know that eating and nap time are times when masks are not worn. And so those, just increase, that mitigation strategy then isn't effective because it's not put into use during those times for other reasons, of course, for safety. So just thinking about how can we do things maybe a little bit differently and also still make it fun. So using those outdoor space, the outdoor areas generally, require just normal routine cleaning and disinfecting. And they really say that we should not be using disinfectants in the outdoor area except for those frequently touched objects or surfaces. So like your handrails or your benches, or if you were using tables outdoors for meals, you would want to go ahead and disinfect them just like you would in your indoor area. So not using our disinfectants on, I know that's been a challenge, like with your slides, with all the playground equipment, that's, kids touch things and we know that, but having them wash their hands before they go to the outdoor area is helpful too. Having that hand washing done before, hand washing when they come back in, and then not having mixed groups on the playground at the same time can really help keeping those cohorts together. The next thing, I didn't see any chats pop up, but sometimes it's hard as I'm reading my notes. I'll just go to the next section. So our next slide is on ventilation, and this is another thing now that we're getting nicer weather, is can we open doors and windows to bring in the outside air, and to it really helps. Having open windows or having fans to circulate air can help that it doesn't concentrate then particles of respiratory droplet particles. So there's some safety. We know it might not work to open doors because that might be a safety risk, but if you have windows that do open, if you can't open them wide, having them slightly open can be helpful. Using fans to really help with air movement, to blow, the inside air out and to kind of bring in air from the outdoors can be helpful. Always use child safe fans if you're using fans. And then, if it's unsafe, there's other ways you can have your HVAC system, look at your air filtration of your HVAC system. Maybe it's a good time to have your HVAC system looked at and to see, is there any way you can increase the amount of outdoor air coming into your HVAC system? And I know there's settings on your HVAC systems for that, and that is a way to bring that outside air in and not be recirculating the same air indoors. So the CDC just has they actually have a information specifically about ventilation for schools and childcare on their website. So that would be a great tool if you're looking at ventilation and trying to figure out what you should do. Maybe not something we can do today, but as the weather warms up, we definitely can think about those things.
Great. And Heidi, we do have one question in the chat box. So
Oh,
I'm
sure.
sure this provider is not alone in being hopeful that as the weather gets nicer, kids would maybe be able to get a break from wearing their mask as they played outside on the playground or in other outdoor spaces. So is the expectation for wearing masks still, and do you think it will be in the future, wearing those outdoors?
Yes, the CDC, is really clear that at this time that masks, they're effective as a mitigation strategy, and we're going to continue with masks. And that's going to be challenging, I know, for children, especially because they aren't at this time able to be vaccinated, and so we don't have any data about how soon we could maybe change some of those mitigation strategies that we know have been effective. So, right now we're still saying mask use, maintaining social distancing when feasible. And we know 6 feet social distancing for children, doesn't always work, but it is still a mitigation strategy that is the CDC and the Iowa Department of Public Health are stating in the recommendations. So. Good question.
Thank you.
The next slide I was just going to talk about was we've been getting a lot of questions about seasonal allergies and also asthma. So I just have a couple slides on those. So we know that the symptoms of seasonal allergies somewhat overlap with and asthma overlap with COVID. And there's kind of on the screen there, you have some information specifically around some of those symptoms that are the same. With allergies, sometimes seasonal allergies, people, will cough, they'll have maybe shortness of breath, maybe not. Congestion and runny nose, that's probably most common. So that's where we really have to think about for consideration is, what do we do for exclusion? We have a child that's having what we understand as seasonal allergies from either their parent or their physician, or if they have that documented in their health record that they have seasonal allergies. So this time of year, when things start to blossom and kids have more problems with that during the spring and summer months. So just so you know that the symptoms of itchy or watering eyes and sneezing are not a COVID symptom. So I think sometimes we're like, well, the child is having, we're not sure if it's COVID or seasonal allergies, but they're having a lot of, itchy eyes and they're sneezing a lot. And so, that my next question is usually, does this child suffer from seasonal allergies? Do you have documentation of that? If they're not running the fever or they're not having any of the other symptoms of COVID, and those are the only symptoms they're having, then, do you exclude for that? Not necessarily. And that's where I think, the children that are in your care and you as the provider, have been doing these daily health checks and know what your symptoms you're looking for. And so we really want to make sure that we're kind of following that best practice guidance. But if you have the child who's having the congestion, the runny nose, they've been kind of sick, they maybe had a fever overnight, or they had a fever for one day over the weekend, but now mom, or dad is saying, what, we think it's allergies, that's a red flag. We want to encourage COVID testing. We want to exclude them. And, if they get a negative COVID test, then they can return to care within 24 hours of fever-free and their symptoms have improved. If they don't get a test and they've had some symptoms that are both, we do know that they're what we call co-infection. COVID has had co-infection with children. We have documentation of that in our state. CDC has followed that. They have information on the website that it is not unusual for a child who has COVID-19 and is positive to also have other things going on, like respiratory type infection, sinus infection, strep, some of those upper respiratory things that tend to run together, colds and flu. So we want to make sure we encourage testing. And if they don't test, then we really need to err on the side of caution, and they need to be out for the period of exclusion that we have in place. Which, if they're having symptoms of COVID, so for example, they're having maybe sneezing, but they also are having congestion, runny nose, and they ran a fever over the weekend, then they need to be excluded for the 10 days from the beginning of their symptoms. And that I know is very challenging for families. That is why we really encourage COVID testing, because if they get tested and it's negative and they're currently having symptoms, then that does give us the assurance that it's not COVID, and it's just, their respiratory, a normal cold during the spring, because they have seasonal allergies as well. So I hope that's helpful information. And then I want to move to asthma. So kind of similar. We know that that children, anyone, adults and children with moderate to severe asthma may be at high risk for severe illness from COVID. So we really want to be safeguarding those children. Make sure you have the child's asthma action plan in place. So if you don't have one, reach out to your CCNC, your local CCNC for assistance. They can help with getting that asthma action plan in place. We know disinfectants can trigger asthma attack, and I will tell you that bleach is one item we have tried for years to not have bleach in childcare, and now we're back to using bleach again. But we know that bleach is an asthma trigger. It's an asthmagen. And there's other chemicals that are asthmagens. So just so you're aware of that, we're spraying a lot of disinfectants right now. I know that. I've witnessed that when I've been out at childcare. That's a great mitigation strategy for helping keep COVID at bay, but also we know that they can trigger asthma attacks. So be aware of that, and then help children to avoid those asthma triggers by making sure they're not in the same space when the disinfectants are being used. Ventilation, using fresh air coming into the environment can be very helpful for that. So trying to look at those asthma triggers that are on the child's asthma action plan, and working with the family and the child care, or the healthcare provider, and working as a team with all of you, safeguarding that child. One additional thing I wanted to talk about children with asthma, because I just recently actually worked with a center on their medication administration skills competency, and we talked about this then, was at this time the CDC is saying that we should not be using nebulizer treatments in childcare, that using an inhaler with a spacer is the preferred method over nebulizer treatments. There's some concern about what happens with if you've ever done a nebulizer treatment, there's a lot of aerosol involved in that treatment, and so that is a concern. So if you have children that are currently having nebulizer treatments done, we would recommend that you reach out to the parent and have them talk with their healthcare provider to order an inhaler with a spacer to be used at the child care center or home, and have nebulizer treatment only be done at in the home environment. If you need additional information on that, please reach out to your local nurse consultant, or you can contact me specifically about questions around children with special health needs. Just wanted to share that the CDC has a new infographic, actually two of them. One is called the Quick Guide, Help Protect Your Child Care Center for COVID-19, and the other one is specific for family child care home providers. I have a little picture of the infographic, but it's a two-page infographic, and it really talks about the mitigation strategies to put into place to help decrease the risk for COVID-19 in your environment. And I love these infographics. I know they've been working on them. I had heard that there was infographics that were coming out, and it was really exciting to see that those were posted over the weekend. So if you haven't seen those yet, that's a great way to kind of visually look at what does mitigation strategies look like in place. And then there's some information on the second page. So it's kind of got the first page just kind of shows some of the mitigation strategies, and some of them are things that we already have in place in our child care guidance. So so it really helps to kind of really reiterate the important strategies that we've been using all along, and that's why we've had a lot of success in our state with keeping childcare open. Thanks to all of you, because we know that's why we're continuing continuing to be successful in our state with keeping childcare open and safe, because we've been doing a really great job. But I really like these infographics. So if you haven't seen them, might be something to look at.
Yeah, I
when
was
you have
just going
time.
to say, I'm definitely a visual learner, so those infographics are really nice to kind of put it all into a nice picture just to see, and then you get a break from reading through all the information. So really nice to have those.
Yeah, the CDC is 17 pages long for childcare. So I liked that you had like an infographic that just had the general information. So the Iowa Department of Public Health Healthy Childcare Iowa website has information specifically for COVID and direct links, and so it's on the printed products page. Go to our website and then click on printed products. You'll see the printed product section, and this is actually where we have a lot of our resources available for download for providers to use. Everything from our asthma action plan to our new choking fact sheet, preventing choking fact sheet, and then we have a COVID-19 resources section. And we also have the link to CCR&R, because CCR&R has a great page with all of their resources, and then also the link to the DHS website. That's what I had for today. So I know most of you know where your local nurse consultant is, but just to show the map on the Childcare website, you can click on consultants and find your consultant, and then it'll show where your consultant is located and their contact information, as well as my contact information is also there. And Deb Geimer in our Healthy Childcare Iowa website office too. So any questions that haven't maybe come in the chat room that we could answer? We've got quite a bit of time right now. So.
Yeah, I was going to ask Heidi, are the childcare nurse consultants available to do virtual visits, or are they going out and visiting programs, or is that kind of just depends on the area?
That's really just started. Kind of, we're getting back out in the field, and I know that's really dependent on there's a lot of factors, in terms of how much spread, positive cases there are in the community. So there's a lot of things that our agencies are looking at in terms of allowing staff to get back out in the field. We are hopeful to continue to provide the services virtually when possible, but we do know that for our QRS assessment tools, we have 3 tools that we provide that are on-site assessments. So really trying to work with providers is how we can work around those situations. I was a nurse consultant I was talking with the other day. She worked with a home provider on a child record review and sat on the front porch doing the record review. So did not, luckily it was a warm day, but did not leave the premises with the charts, but also could do the chart review and complete that assessment so that the provider could access those forms to submit for the QRS application. So we're working and we're being strategic. We have a guidance document, of course, to be safe, because that's the biggest thing. We don't want to cause any safety issues to occur as a result of us making visits. Really limiting access to being in the same space as children, because most of the time we know children aren't able to be wearing a mask or aren't wearing them consistently, depending on their age. And so, with the nurse consultant wearing a mask and teachers wearing masks, we may be able to meet with the director of a program, but in terms of going in the classroom, that makes it more difficult. So just being strategic and working around those systems in place. So it's just a start. Reach out to your local nurse consultant if you need a visit. I know that it's just a case-by-case basis depending on the area of the state that you're in. But our goal is that we will all be back out in the field as soon as possible.
Absolutely. Similar to our agency then too, getting out there when you can, kind of depending on the situation, but always a good resource, your child care nurse consultant. And I know that you're available yourself for questions, so that's helpful as well.
Yep. And then we'll do virtual visits. We're doing virtual visits. So that's one thing that we definitely can do. I mean, phone, email, virtual visits, no problem at all for those. So.
Awesome, thank you. So this may be a question more for the other providers on, and Heidi, you can definitely interject here if you have any experience, but a provider is wondering if anyone has safely opened their building back up for parents coming in. This particular provider is still screening children at the door and excluding parents' entry to the building. I know in my experience, that's what most providers are still doing. I don't know if you've had experience with that, Heidi.
The one thing that I know that has changed, and this is a recent change with the CDC, is they're really talking about, we want to limit, outside individuals coming in, but we also want to be aware that children with special health needs may need therapy or speech, or an outside observer coming in for a developmental assessment, or other entities that may be coming in, that it's important for that child to have that. And so we need to put our mitigation strategies in place, but still allow that. And then the other thing is opening up for breastfeeding moms. That was something new that was just added over the weekend on the CDC website, talking about that we really need, I know we are limiting parent access into the buildings, but for breastfeeding moms, we want to support the breastfeeding mom and baby. And so best practice would be to allow them to come in to provide breastfeeding for their infant. And then, so then that just goes into how are you going to do that safely? And do you have the space in your facility to do that? And that might be a challenge right there, because not everybody has the space for those kinds of activities. But that is on the CDC website. I saw a few chats that came up of different things that people are doing. Definitely wearing masks in the building.
And then another question, if a provider is vaccinated, what's the requirement for positive cases in the home? Is there any change there now that vaccines have came out?
So our current child care guidance document has our exclusion criteria, and then some information on quarantine, isolation, quarantine, and then testing, and then what would be the requirement for exclusion for a period of time. And just be aware that could be changing, because now that we have individuals that are fully vaccinated, there is some additional guidance that has been coming out from the CDC for that population. And so we're not sure how that's going to look for childcare. So if you're fully vaccinated, or if a parent is fully vaccinated, what change that may be for our guidance document around exclusion and quarantine. So just be aware that could be changing, or there could be some additional guidance that specifically addresses that, and we'll just keep you informed. Where you know how that is when things change, and we're just kind of trying to figure out where we go next with some of our guidance. But I do know that's a good question, because I do know that that is something that is being looked at currently.
Yep, the information's always changing, isn't it?
You have to be flexible.
Yep, some of you are sharing in the chat box what you're doing at your program, so that's nice. Thank you for sharing in there. One other question, Heidi. Providers' childcare kids that are over 2 have been wearing masks since it was recommended, but she just wants to be clear, is it strongly recommended or mandatory for children?
Well, I'm going to refer to our child care guidance that is current for DHS IDPH agreed upon guidance, which is February 4th. And adults are required to wear face coverings if medically appropriate. And all children 2 years of age and older should be encouraged to wear a face covering when able to do so correctly and safely. So that is our current guidance. So definitely highly recommended. Where, you know, the CDC is really encouraging that children wear face coverings or face masks in the childcare setting. But that's what our current guidance says. Good question.
Any other questions any of you might have for Heidi while we have her on with us?
It's great. Great to see all the stuff in the chat box. It's nice to see everyone sharing some of the things that they're doing, which is wonderful.
Do you have a link for the February guidance, Heidi, that you could put in the chat box?
Sure.
Awesome. Thank you for doing that.
Sorry, I had to switch a few screens to get to that.
We have a provider ask about parents wanting to get vaccinated, and that a lot of the parents in her program don't really want to get vaccinated. So she's wondering if there are resources or what she could do to encourage them to get vaccinated.
You know, I would really use that toolkit that the CDC just posted. They have some really great information that you can put right into a newsletter or a fact sheet you can hand out. You know, it's everyone's choice. And we know that with other vaccinations too. You know, with the flu vaccine every year. I mean, we want to encourage, but it is a choice. But I think it's a lot of just getting people the correct information. That really, vaccination is such a great strategy to reduce the amount of COVID cases in our state, and that's just going to continue, in our country, and that's going to continue to help us move towards herd immunity, which is what we want. We want enough people vaccinated that have, you know, that are out, so that we can kind of move to that next strategy of containment. So and have those numbers go down. So using that toolkit that I know you posted that in the link into the chat box, that new toolkit just has some really great information that you could send. Even, you know, if you have a website, you could post stuff on your website. You could, you know, send out a link to your parents with the fact sheets or with the promotional promotional information. So, and then, you know, if they have questions, you know, have them, you know, reach out to your local nurse consultant. We take parent questions all the time if they have a specific question, or refer them to their healthcare provider. I think that's a great resource too. Yeah, I know that in that frequently asked questions, there's just a chat here that they have some concerns about the vaccine, and there is specific information in the frequently asked questions regarding some of those concerns. A chat just came in about, you know, masks, and is there a light at the end of the tunnel? I hope there's a light at the end of the tunnel because I'm ready for it.
Yeah.
So I think we're just, you know, it's a process, and we need to just continue to, you know, we've done such a great job, and that's, I mean, to be honest with you, you know, all of you have done such a great job, and so we want to continue to safely move forward, and with hopes that, you know, eventually we will be able to, you know, go back to normal. I don't know what our new normal maybe will be, but I know masks are challenging. in the childcare environment. They're challenging for everybody, for adults too. Good question. Good chat. Yeah, we do know masks work because we do know it has really reduced the number of illnesses, other illnesses that we normally would have seen in childcare that we have not seen in the last year. So we know masks have really helped with even that, not just COVID.
Yeah, and I was going to say too, just making that connection for parents that, in order for them to be able to go to work and make an income and be successful at work, then their childcare program needs to stay open. So following those mitigation risks or doing all that you can really is important for everyone and not just yourself. So yeah, definitely a good point to be made.
Oh, yeah, excellent point. Yeah, because we do know, I mean, one family who is positive in COVID for childcare affects the whole childcare program, because then their child has been in care, and that has been so challenging when we've had to have quarantine of a whole group of families because of a family was positive and then the child was positive, and so then who were they interacting with, and so then it just impacts a whole group of individuals. And so that's definitely a good point. And like I said, with fully vaccinated, there is some language in the CDC about if you're fully vaccinated, in terms of being with other fully vaccinated individuals. And so that's where, like I said, be aware that, guidance may be changing around like quarantine and around some of those things because of some of the information that's in the CDC. The question is just kind of the whole thing about fully vaccinated and do they have to wear masks? And so there's some, and I can look that up real quick if you want to answer any other questions while I look that up. Joy.
Yeah, sure. Another really good one just popped into the chat box, and I'm kind of off with my timing, COVID and working from home and all of that, but I do realize that it's spring break, so I'm surprised we haven't gotten this question yet. So thanks, Michelle, for asking it. But do you have any advice for providers with parents or families that may be returning from Florida or Mexico or any other destinations, in quarantining after travel?
Yeah, actually, that was just updated specifically around travel. So I'll pull that up also. So this is what I'll just let's see. I can share my screen and I can show you.
Sure.
So this is the key points that the CDC has posted. And let's see, I'm having a hard time scrolling, but I think the question that was coming up was the fully vaccinated people can, and it says visit with other fully vaccinated people indoors without wearing masks. So that's, that has come up. I've had that question already. But the thing is that that's a different scenario than what we have in childcare, because we have children coming from other, that are not vaccinated. And so, and they're not from a single household, they're coming from multiple households into your environment. So that just changes that whole scenario compared to, fully vaccinated people indoors. So just so you know, that information is on the CDC website and it's under the vaccinated section. And then about travel. So, on the DHS guidance document. So I'll first talk with what's on the DHS guidance document. The childcare guidance of the February 4th around travel says that you want to encourage families to review and follow the CDC guidance on how to protect yourself, with traveling. And so travel specifically, that's just been updated. So if you want to kind of look at that information, that might be helpful for you. Let's see, I'm going to stop my screen sharing for a minute and pull something up. So specific to travel. So basically what the Iowa Department of Public Health website has on travel is that travel can increase your risk of spreading and getting COVID-19. And so they say postponing travel and staying home is the best way to protect yourself and others from COVID. It says if you do decide to travel, take these steps to protect yourself and others. Get tested with a viral test 1 to 3 days before your trip, and make sure that your results are negative before you actually travel. And then it says, get tested again with a test 3 to 5 days after your trip, and stay home and self-quarantine for a full 7 days after travel, even if your test is negative. So that's the question that I've had, was would a child returning from traveling abroad or traveling to Mexico or, spring break or whatever, what would they need to do? And what is in the guidance document is that, you test when you return after your trip, that you should stay home and self-quarantine for a full 7 days after you travel, even if your test is negative. And then if you don't get tested, to stay home and self-quarantine for 10 days after travel. So that's kind of a little bit of a change. That's what the Iowa Department of Public Health guidance has on their website. And then when they say that there's really no standard guidance or standard definition of travel, but really looking at travel when it's, airfare travel or, airports, bus, train stations, rest stops are all places that travelers can be exposed to the virus. So really looking at that. So, for our information on our, child care guidance, you want to have families follow that CDC guidance. And then, like I said, that has just been updated. So that was just posted recently. And then also the IDPH posting was just recent, I think over the weekend. I'd have to look at the date. So that's a challenge. I know if programs are trying to decide what they're going to do with children returning from spring break. It is your exclusion policy. And this is the other thing is, it's no different than any other time. It's the child care provider's policy in terms of if they would have children be able to, you would determine, and you should be looking at that CDC guidance and what the Iowa Department of Public Health and local public health is saying in terms about travel. So you can always reach out to your local public health about travel. And then it would be your policy if you would have the child be able to return sooner or later. So
good. And another good question in the chat box. Is there any information or additional information on school quarantine guidance versus childcare guidance? In this person's experience, sites and some families are struggling with the differences between school and childcare.
Yeah, and each school district, they have some general guidance on the Department of Education website, but each school district determines their guidance, how they're going to put into place the specific mitigation strategies for their school district. So I would refer, that child care provider to their school district local resources to see if they have some information that they have posted on their website specific around quarantine, travel, those kinds of things. But we know childcare and school are different, and that can be challenging for parents because they see that they say, well, my child can return to care or can return to school, but they can't return to care. And so that's where we know that there's going to be situations where a school setting is much different than a childcare setting. And we know part of that is just because physical distancing is more, often can be accomplished in school settings because they can space chairs apart, they can space kids apart, they have bigger areas than what childcare normally has in their classrooms. And then also school-age children can all wear masks unless medically, they are unable to, but most school-age children and most schools are requiring mask uses of children and staff. So I think that's part of the struggle between the difference between the Department of Ed and their guidance and childcare. So, but I know that's frustrating for parents, and I've been told that. So, I know that because it'd be great if we were all on the same page, but we just know different environments.
I know, I was just going to say, Heidi, do you have any ideas or anything on how maybe, childcare providers or us at Childcare Resource and Referral can partner better with districts to have more consistent information for families? Or
yeah, I do know, a lot of our local nurse consultants work with their school districts and school nurses. A lot of times we have a lot of shared spaces, so that's a lot of, it's this shared space. And so, we have general guidance documents for the whole state. That's the DHS and IDPH approved guidance. And so, there are going to be times where you're going to need to make sure you're following that guidance document because that's what's in place. But trying to work with your local district to say, this is what we have in place, and especially for like those after school programs and things like that. So. So just communication, I think, is really key, is reaching out and communicating.
Yeah, and there was another comment, about having different policies in childcare and, what they hear from their doctors. And we just talked about, in school settings. So I really think the important thing to remember too is that it's your business and you can have your own policy around that. And like you said, Heidi, communication with parents and families as to why the policies might be different and why you have those certain policies in place can definitely be helpful.
Yeah.
All right, well, we are about to the end of our meeting. I don't think I missed anything. You see anything I missed in there, Heidi?
Yeah, I was just looking at the chat real quick. I know Angie just posted something about doctors saying that they can come back in 10 days. And I will just tell you, the CDC is still clear on their website for the general guidance for quarantine. And when you've had an exposure, it says 14 days. It still says 14 days is best practice, and that a shortened quarantine can be considered in certain circumstances. And so we know that, for like infants and toddlers who cannot wear a mask, having them come back into care at 10 days or 7 days is just doesn't work for childcare because because we have, younger kids in care, or we have kids that are taking their masks off during mealtime and they're all sitting at the same table with other children with their masks off. So that's probably the challenging part, that a lot of times a physician may not understand that child is attending a group care setting, or how that group setting is put into place in terms of mitigation strategies. And so just communication is important. So, okay. Thanks for all the great questions. I hope this has been helpful. If you have any additional questions, please forward those to me, Julie, or if you have a question, reach out to your childcare nurse consultant locally. Because like I said, each area of the state, we have our general guidance and we need to follow that. But we do know that in all areas of the state, it's sometimes that that information locally can be really helpful from that local nurse consultant.
Sure. So would you say that the CDC is just really the best source to direct families for information, for accuracy?
Yeah, between the Iowa Department of Public Health website and the CDC, and a lot of the Iowa Department of Public Health website link you to the specific place in the CDC. That's probably the challenging part, is there's so much information that sometimes it's hard to find the specific thing you're looking for. And so I know the Iowa Department of Public Health has specific areas like for childcare or for schools, and then it'll link it to the most current document on the CDC website around that topic. So that's, yeah, definitely the CDC is a great resource, but sometimes hard to maneuver through those. There's a lot of links. So reach out. We can always help direct you to the most current information, and the most direct link too. And I know CCR&R does the same thing, and they do a great job at that too.
Yes, thank you. Yeah, your child care nurse consultant's really a great resource for you if you have any questions as a provider or as a family. You can also always reach out to me. My contact information is up on the screen. I did send out the invite for this meeting, so you may already have me in your email box. So like Heidi said, feel free to reach out to me or your consultant or to your nurse consultant or to Heidi, and between all four of us, we can get your questions answered. So the meeting has been recorded, so I'll go ahead and stop the recording here in a couple minutes, and then I'm going to just go ahead and send out that link to everyone who sent me an RSVP. That way you can access this again later if you need to. Thank you so much, Heidi, for being on with us.
Thank you, everyone, for attending, and thank you, Julie, for having me.
And happy St. Patrick's Day.
Yeah,